Very warm welcome to all of you, and thanks for joining in today's session. Our guest speaker is today Dr. Aparna Gupta. She's a senior consultant and associate director of neurology in Indian Spinal Injury Centre, New Delhi. So, over to you, ma'am, and thanks for joining in.
Good good afternoon, everyone. I think you have already had my introduction, and the topic of today is hypertension. I guess everyone is aware of hypertension. It needs no introduction, but yes, it needs reinforcement, it needs awareness. That is sure. So, hypertension, the burden of the disease, अगर हम world का देखते हैं data, so the burden of the disease is like 1.38 billion, and in India it is 1 million. So the burden is quite high. So reduce the burden and to reduce the complications which are associated with it, we are discussing few points today. Hypertension, what it is exactly? It is the force with which the blood flows in the arteries of the brain, heart, legs, or whole part of the body. Whenever the blood flows in force, it causes damage, which is a normal mechanism. It is the normal rule. Whenever you are in force, it causes damage. And that damage causes, a lot of cholesterol deposits in the arteries, leading to stenosis or obstruction, which further leads to its complications. So this is what is hypertension is all about. Hypertension can be, 80% it is primary. Primarily means because of any heart or heart associated diseases. Because heart is the main, point from where the blood is pushed to the whole part of the body. 20% it can be secondary also. It can be secondary to any kidney diseases, renal diseases. It may be associated with any metabolic disturbances also, like thyroid or diabetes. Now, when you will call for hypertensive or not. So, AHA has given certain criteria to it. AHA has given certain criteria like if your BP is for a normal person less than 40, the BP should be 120 by 80, which is normal. 120 by 80 to 130 by 80, it is considered as bit on the higher side, but still normal. 130 to 140, it is stage 1 hypertension. That needs vigilance. That needs vigilance. And stage 2 is more than 140, but less than 150. So this is how the stages of hypertension has been categorized. Now, the people will say, how we will come to know that our level of blood pressure is on this range. So who has done certain guidelines for a normal person with no genetic history, because genetic has 50% predisposition, has 50% contribution. So if you have a genetic predisposition, get your BP checked at least twice a year. And if on two different occasions में आपको लगता है कि आपका BP 140 by 90 से above है, it needs to be addressed. For a person, there is no genetic history. If you are less than 40, once in a year, BP monitoring is good enough. Even if you are above 40 with no other medical history, once in a year is good enough. Now, what are the risk factors of hypertension? This is what we came to know certain criteria of hypertension. Now, what are the risk factors of hypertension? There are 5-7 risk factors, which is very important. First and foremost is your lifestyle. That is nowadays, the hypertensive, as we see the data, it is more common in the urban than in the rural. And the cause is probably the sedentary lifestyle. Second, the anxiety or the stress, which is more common in the urban areas. That is why hypertension is associated with that also. Third is sleep, the sleep patterns, maybe because of the, lot of MNCs coming into it and the pattern which is gradually changing, So the shifts, because of the shift system, and there are certain sleep disorders which are associated with it, like RLS, insomnia, and the most common is the apnea. So stress, sleep, your eating habits also. Eating means in the urbans, as you say, they'll use more of processed food. And the lot of trans fats and all, because fast foods जो हम use करते हैं, that also aggravates or severity of hypertension. Other common things is lot of use of alcohol, smoking. That is one more thing. And extra salt usage. Extra salt usage in a sense means the food which we're using, like the fast food and all. They are rich, or the packed foods. Fast food along with packed foods, they are rich in salts. That also is leading to increased incidence of hypertension. Now, how would you come to know? Are there any symptoms for it? What we have come across, it can be a silent killer also. At times, people don't know. First time they present with a massive stroke, with a massive bleed in our emergencies, and which can be life fatal also. That way also. But yes, there are certain symptoms which you should acknowledge if they are occurring for the first time to an intensity which needs to be addressed, or if they are occurring again and again. The common things are like dizziness. If you feel number of times dizzy, headaches, which are mild headaches, which is occurring again and again, associated with vomiting. Ulti jaise hai, nahi hai, giddiness associated with headache is there or not. You're having blurring of vision, your visual blurring is there, okay? Or any hemorrhage in the eye, sudden hemorrhage in the eyes, any nasal bleed, and numbness, you are having on and off numbness in the face, either half, either right or left, or in the legs, having breathing difficulties, suffocation. These are some of the common symptoms of high BP, which needs to be addressed. Now, the other thing starts ki what are the complications. Suppose you don't address these symptoms. Suppose you are not addressing these symptoms. So, will it lead to any complications? Yes, it can lead to complications. As we discussed earlier, what is hypertension? It is because of the rapid or forceful flow of the blood in any part of the body from head to toe. So, if that is not well controlled, it can cause, if we count from head to toe, it can cause stroke, it can cause visual loss also. Visual may retinal detachment or retinal hemorrhages, which is the main area for the vision. That hemorrhage हो सकता है, आपकी eyes bleed कर सकते हैं. It can also cause your heart disease, heart attacks, heart failures. It can cause renal disease also. The kidneys functions may be affected. Your leg functions will also be affected. What we call as peripheral vascular disease. In this, जो भी blood vessels आपके legs के होते हैं, they block हो जाते हैं, leading to blackness of the legs, gangrene formation होता है. At times, अगर timely address ना हो, it can lead to amputation of the legs also. So these are the common complications of the hypertension if it is unaddressed. Next, we will speak about the management part. Suppose you have been diagnosed, and as I have already discussed earlier, if you have found in the still stage 1 of the disease, if your BP in 2 different occasions, if it is found between 120 130, it needs a close observation with the help of your specialist. Close observation means lifestyle modifications, which is very important. I think this is important for a normal person also. But yes, if you are found in the stage 1 of the hypertension, these lifestyle modifications needs to be there. Lifestyle modification means to modify those things which are already risk factors for the hypertension. First and foremost, your salt intake. Your salt intake has to be low. Now, the American AHA has given a particular diet which we call as DASH. That is the diet associated to stop hypertension. DASH, DASH diet. DASH diet includes low salt intake. Low salt, अब आप पूछेंगे how much? So they have recommended like 1500 milligram. 1500 milligram is a small teaspoon is equal to 5 gram. So it's like 1/3 of a teaspoon. That amount of salt in a day for a single person. That can be reduced by 2 ways. What I suggest, stop, using table salt, which needs to be avoided. Use salt. Don't go for zero salt, because then again Low sodium has its own implications. So go for low salt. Use salt, but in a moderate dosage. Second, we have to include a diet which is rich in potassium, magnesium, and calcium. All these three things help in conductions of the blood vessels. So we should take fruits, vegetables, whole grains. We should always take lean meats. Lean meats like breast of a chicken or a turkey is recommended. We should avoid red meat or any other kind of meat. Fish is recommended, no doubt. Hello, hello.
Yes, ma'am, you are audible.
I'm audible. Okay. So this is the normal diet. And apart from the diet, what they have suggested is at least 30 minutes of walk in a day. So we should not have a sedentary lifestyle. The walking should be there. Either 30 minutes a day for 5 days a week or 150 minutes, as you can decide. This is the, I say, yeah, close to it. It's not like strongly you should stick to those datas, but like close to it. These are the normal norms you should follow. So this is the dietary thing which you need to do. Alcohol and smoking definitely in moderation, because otherwise also there are risk factors for the stroke indirectly through hypertension or directly. That is important. Then salt intake and this diet along with exercise. Sleep, yes, sleep is very important nowadays. It has come as one of the, I think, risk factors, because I'm a neurologist, which I'm facing in my OPDs. It has come one of the risk highest, one of the upcoming risk factors, I would say, both in heart disease, in brain stroke, as well as in hypertension also. So sleep में normally तीन टाइप के जो common sleep issues होते हैं. First is apneas, जो आजकल everyone knows it. Snoring के साथ, if your sleep is not proper, you should always go to your specialist, get a sleep study, get investigate. Second is insomnia. Now insomnia may be because of the shift patterns or underlying any behavioral issues or mood disorders. People have chronic insomnia. So insomnia means if you're having on and off or situational insomnias, nothing to worry. It's very common. If you're going to a new place, you're not getting sleep, it is fine. But yes, it should not be chronic, like you're having for months together, like 2 or 3 months, chronic, your sleep is disturbed. Then it needs to be addressed, like what is the cause of insomnia. Third is the restless leg syndrome or the RLS. RLS is a disease because of the deficiency of the iron or certain hormone, certain dopamine, which causes restlessness at nights. And the people are unable to sleep. Once they are walking, you're doing the job, standing, morning they are comfortable, but at night they can't sleep. So if you have those issues, you should go and meet your neurologist, get the problem solved for the betterment. Yes, then comes the stress. In stress, again, you can opt for, I think there are two ways. One, yourself, you can avoid yoga, which is one of the best stress buster, I would say, brain relaxing exercises, or with the help of the, if you feel you have underlying, behavioral issues, with the help of the psychologist, you should go for cognitive behavioral therapies, which again gives you anti or anxiolytic, exercises. Medicine is not, exercises they are going to give you. So this is how you can take care of your hypertension in, if you're not being diagnosed, to improve your quality of life, and secondary when you're still stage 1 of hypertension. In stage 2 or above, stage 2 or above, definitely you need to consult your specialist, get the medicine. Along with that, definitely lifestyle modification changes are equally important to them also. Blood pressure of more than 180 and 120, that blood pressure needs hospitalization. Even if you are having a single reading, that blood pressure requires hospitalization for the observation purpose and for the medication purpose, for the optimization of the medication. So this is how we manage hypertension. Yes, for hypertensive patients who are already being diagnosed, and who are on medications, like not single doses, but who are on one or two medication polytherapy for a certain period of time, I think they should do a regular visits to the physician or to the specialist. And there are few tests, I think, which they should be doing it maybe every 3 months or 6 months, depending upon their reports. And these tests would be a blood test, I would say. A simple CBC will help. CBC, kidney function test, is very important. urine routine, that is the routine workup of your urine, and 24 hours urine protein. That is very important to rule out any kidney diseases. For heart, echo is very important. Ultrasound abdomen is important. Along with that, some metabolic factors like thyroid and HbA1c to rule out any associated diabetes. Because if other illnesses are associated with this, then also it increases the risk of hypertension leading to other disease like stroke or CAD. So this is how we manage those patients. One more thing I would like to say, thing, at times patient have anxiety and all. Patient have anxiety, and that point of time the BP shoots up to 150 or 180. So what we do, the high BP at single reading should not be like, should we should be vigilant about it, but it should not be like it needs to be started on the medication. BP means the patient has to be relaxed, comfort, cool for 10 to 15 minutes, and then her blood pressure needs to be checked. That's very important. This point I forgot earlier. So this is very important. Uh, I think I'm clear. I'm through with my things. Most of the important points which I wanted to share with my audience. If anything, they can let me know. Hello. Hello. Can you hear me?
Ma'am, yes, you are audible. Please go on.
Yes. See, I finished my session. I primed them what is important for a common man. You should know uh, that is there. But if they have the queries, they can always put up in the chat box. I can answer
Yeah,
them.
it's there. You can answer it.
I think I have got one query. They have just asked me to please cover in your session next between sleeping disorders and cardiology and neurology with cardiology. Okay. Sleep comes under me only. So definitely we can cover that. So I think someone has wrote me how to control an excessive anger and get set up quickly after being upset. See, there are two things. One could be physiological. हर चीज, everything is not disease. What I personally feel, हर चीज disease नहीं हो सकती है. कुछ हमारा basic nature होता है. ठीक है ना? Everyone has the basic nature. Some are aggressive, type A personalities, some are cool and down. तो अगर आपकी basic personality है, तो मुझे ऐसा लगता है, रिलैक्सिंग टेक्निक्स होती हैं, एंड एंगर मैनेजमेंट, जो with a psychologist, you can consult them and then have a control over it. But if it is not your basic nature, which is not in your family or something like that, or you don't have an earlier history of any other behavioral disorders, in that case, you require some medication and genetics you require. This is how we take it. Okay, there's another question. I have hypertension over last 25 years. What should take care myself? See, that's you have to take your medicines regularly. You have to take your medicines regularly. That's very important. And obviously, you have to do exercises along with the other, the DASH diet, which has been, recommended. I think it's very ideal diet. Along with that, your medicines regularly, and should visit your, specialist every 3 months or 6 months, as advised by him. Would you like to understand the long-term impacts of hypertension in prevention of the same? I think I have already covered in my talk about the long-term impact of the hypertension. Still, I will repeat it as it is said. Hypertension is basically the aggressive or the rapid flow of the blood in the arteries or the vessels in whole body. So complication, if you are not able to control it, no, it's very aggressive. You are not able to control it. Complications, if we start from head to toe, stroke in the brain, okay, eyes, vision loss हो सकता है. There can be hemorrhage in the eyes. There can be retinal detachment. Back of the eyes में there is a layer in which if the blood gets collected, you can lose your vision for long. There can be heart attacks also, which we call as CAD. There can be heart failures also. Kidney problems, because of the high BP, kidney also faces a lot of pressure to filter it. So kidney can also get damaged. Your blood vessels of the legs, that also can get damaged because of the high BP. The cholesterol gets deposits because of the damages के कारण, which lead to diseases of the legs. They are similar like that of the brain. हम brain stroke के बारे में जानते हैं, हम cardiac stroke के बारे में जानते हैं, but कोई legs से related जो strokes होते हैं जिसको हम peripheral vascular disease बोलते हैं, common man doesn't know. Okay, and that also, if there is a blockage for more than 50%, needs angioplasty. So this is how the level, if the hypertension is not being addressed properly, can lead to all these complications. Okay. Okay, have recently checked, have my blood test report in which there is high cholesterol. Is it related to hypertension? Uh, He's the same person who have asked me the earlier question. I don't think so. They are equally related to it. Cholesterol is a different thing, and hypertension is different thing. Yes, hypertension can cause a lot of cholesterol deposit in the arteries, but again, it can be related, it cannot be related. Both is like not 100% correlated. I'm having diabetes with no BP. I'm having sleeping disorders and anxiety sometimes. Can you explain why it is happening? Sleeping disorders, which I told you, you have to find out. Sleeping disorders is a very vague term. Okay, you have to visit your neurologist because he or she is the one who's going to categorize it. What sleeping disorders you have. Either you are having apneas, yeah, you are having RLS, you are having insomnias. There is one more sleeping disorder, narcolepsy. Patient sitting and they go off to sleep. They doze off to sleep. They needs to be, literally they cannot stop their sleep. And multiple times, then they get up. So you have to get it categorized. What kind of a sleep you're having it. Sleep disorder you're having it. Accordingly, the medications are there. Sarath, I'm having that. Okay, I answered you. I have a BP from the age of this. I'm having a tablet and is right to use tablet lifelong or have any alternative. See, if you are 27, you are quite young, I guess. And whenever the blood pressure is there, less than 30 years of age or less than 40 years of age, sorry, in that case, you need to find out one, is there in a genetic history? If yes, well and fine. If not, there are other causes, metabolic causes of hypertension also. So that work needs to be done with the help of the specialist, first and foremost. And secondly, yes, if your BP is well maintained with telmicaine 40 or any medication XYZ, it needs to be continued. One myth I want to burst. Normally, the patient comes to my OPD, they are taking medicines and the BP is fine. So they say, Madam, मैंने छोड़ दी दवाई because BP तो मेरा ठीक चल रहा था. See, they don't realize the BP is being normal on medication. So there is no harm in taking medication lifelong. It is nothing like dependency or any other thing. These medicines are working on your arteries to keep the pressure normal or to prevent the complications. Okay, so if it is actually a hypertension, the medicine can be taken lifelong without any side effect. Yes, there are some medication which do have side effect, but your specialist is good enough to modify them as and when required. Any other questions? You can ask questions. How can bodybuilders maintain hypertension and what is their average lifespan? How do I know bodybuilders? But one thing I can say about the bodybuilders means the people who gym a lot, they use that whey protein, they use those products to, build up the muscles. And that I have a perception they use steroids or something, which indirectly can also give rise to hypertension. So that way I can tell you ki always, use meticulously, especially the gym people. You're building up your mass because it is suggested by the gym people, but how much they are educated about the content or everything, that's very important. Okay. Lifespan, I can't say. What is difference between hypertension to young people and old parents level? Difference is nothing. Hypertension is hypertension, whether it is young or whether it is old. In old, the common is, if there is a genetic one, there's common associated diabetes, cardiac disease, or so many other things. In young people, the causes are a bit different. They are all diabetes, other things are also the causes. There are certain cardiac diseases which is common in the youngsters also. So, but there are other causes, like certain kind of kidney diseases, primarily kidney diseases hoti hain. It's not the hypertension causing the kidney diseases. At times there are certain kidney diseases, autoimmune kidney diseases, which indirectly can also give rise to high BP. So it is a vice versa. 32 considered hypertension, 35 to 95 considered hypertension. Okay, it is risky to work out in gym or to cardio when a person has hypertension. So I have already discussed there are four criteria, 135 to 95. That is the stage one. Stage one hypertension, and the line of treatment remains the lifestyle modifications. है ना? More than 140 by 90, that is stage two, and that requires medication plus lifestyle modifications. No, there is no risk. You can do your gyms. There is no contraindication for gyms in hypertensive patients. Not at all. Father is 80 and he's taking medication of high BP since last 4 years. Recently, in one of the checkups, his BP is almost normal. And that doctor said that now they need not to take medicines. See, if he's truly hypertensive, means if under normal circumstances, if he's being cool and calm and his BP medication being started with no associated behavior problem diseases like no associated anxiety factors or mood disorders, and then the medicine needs to be continued. If the doctor is saying he needs to be stopped, maybe during that period of time he might be anxious or something, or for a short duration his sleep might be disturbed or something. So the BP got aggravated and the medication started, and the contributing factors now have settled, so his BP also settled, and so they have asked for the to stop the medication. But if it is a primary hypertension, normally we don't stop medication. It all depends at that particular day or two different occasions, what are the other contributing factors? Whether he's calm, there's no anxiety, there's no mood disorders, there's no associated headaches. So these factors needs to be taken into consideration. Taking medication for hypertension for longer period, any side effects? No, there's no side effects. There's hardly any side effects. Even if cholesterol levels and triglycerides are maintained normal, then also blockages occur in the heart arteries. Yes, yes, because this cholesterol, your blood cholesterol is related to your the cholesterol in the arteries to a certain extent, but not 100%. Okay, so yes, even if this is normal, still you can have deposits in your arteries, but chances are less. Is diastolic pressure of 90 and with the BMI of 37 is normal? See, BMI is really high. It has to be somewhere around 25 to 26. 37 is obviously high. Diastolic pressure 90 is again comes into a vigilant period. As I already discussed, one third, 120 to 80. 120 होता है सिस्टोलिक. सिस्टोलिक जब हार्ट पंप करता है ब्लड, व्हेन इट फोर्सेस द ब्लड, दैट इज अ सिस्टोलिक प्रेशर. जब हार्ट रिलैक्स करता है, देन इट इज द डायस्टोलिक प्रेशर. सो डायस्टोलिक प्रेशर भी 190 needs to be a vigilant one. 80 tak it's fine depending upon the age. What's the age? It's not being mentioned, but if it is a young, then it is fine. But BMI is still on the higher side is there, so it needs a vigilance. I want to know that chewing tobacco can increase blood pressure. Okay, yes. Is weekly shifting like 1 week day and 1 week night work culture can also increase blood pressure, or sleep disorder is the main cause of high blood pressure? See, it's not directly sleep can affect it. It is the sleep because your shift is shifting on days. So, because of that lack of sleep, now further up, you are able to take the sound sleep or not. There are some people who can sound sleep, even if one day they are working night, other day they are working in the morning, third day they are again working the night, but still they are able to sleep properly because आप normal physiology of the body को alter कर रहे हो. So whenever you are affecting the normal physiology of the body, definitely आपके sleep patterns affected होंगे. आप you will not be able to sleep properly. So if you're not able to sleep properly, your the anxiety levels, although indirectly, would be high. So in that way, it increases the hypertension. Directly, it doesn't cause any effect. If you are able to maintain with it, with the sleep of 4 to 5 hours properly, without having a sound sleep post that, I don't think so it's going to cause directly any impact on the hypertension. See, 1 or 2 days I already mentioned, एक दो दिन से कुछ नहीं होता, एक दो हफ्ते से भी कुछ नहीं होता है. क्रॉनिक मतलब 2 से 3 महीने अगर ये पैटर्न फॉलो हो रहा है और 2 से 3 महीने तक आप इंसोम्निया में हैं, आप स्लीप प्रॉपर नहीं कर पा रहे हैं, then it starts impacting your physiology. Does it lead to the development of varicose vein? Varicose vein is a different thing. Varicose vein अलग चीज है. It is not related to hypertension. It is basically your veins. जो आपका बीपी का ब्लड प्रेशर होता है वो आर्टरीज के थ्रू जाता है. हमारी बॉडी में दो प्रकार के ब्लड वेसल्स होते हैं. एक से जिससे कि हमारा ऑक्सीजन ब्लड पूरी बॉडी में जाता है, जो आपको एनर्जी देता है. इट्स फ्रॉम द हार्ट. Heart is pumping it through a big vessel which is called aorta. Aorta pushes the blood down to the brain through the arteries above the neck to the brain, down to the legs, to the liver, spleen, abdomen, lungs. So these are arteries which carry oxygen blood from the heart. They are known as arteries. The varicose vein itself, you can see, vein is the other part of the vessel होता है जिससे कि deoxygenated blood आ जाता है, जो कि bad blood होता है, which needs to be moved out of the body, filtered through kidney होता है. So varicose vein has nothing to do with the hypertension. Yes, I can just let you know, varicose vein उनमें ज्यादा common होता है जिनमें genetic predisposition होता है. Secondly, ओवर वेट होते हैं. एंड thirdly, जिनमें जिनका जॉब प्रोफाइल होता है प्रोलॉन्ग स्टैंडिंग, दैट कैन गिव राइज टू वेरिकोज वेन. Any other question or doubts? You can ask doubts. No. There's a question that my BP remains 130 to 190, so I take amlodipine 2 to 3 days regularly and then I don't take it. Sir, it's always better to take that amount of medicines जो थ्रू आउट लेना. ऐसा नहीं कि 3 दिन आप हाई डोजेस लेके 2 दिन उसको ऑफ दे सकते हो. द रिकमेंडेशन इज टेक low dose, whatever dose is there, which keeps your BP normal in all the days, throughout the days. There's don't stop and for BP medicine it has to be regular. It is nothing like 5 days liya 2 दिन छोड़ दिया, nothing like that. It can be risky because next 2 days हो सकता है सुबह बीपी जब आपने लिया हो बीपी सही हो, but शाम को there's sudden burst. So it's always take that particular dose which keeps your BP at a normal range throughout the week. Yes, ये इसमें तो हो गया. हेलो.
And few more queries are there.
अच्छा ठीक है ठीक है. No issues. There are few more queries.
Chat box में है मैम. Can you check it?
It's not. Can you please suggest what could be the cause of my peroneal nerve weakness? I'm unable to fully lift my right leg and cannot walk normally. Also, how long might it take to recover? So this is altogether a different thing. Peroneal nerve palsy, there are causes can be multiple. So unless you have a detailed thing, we don't, to give you how much time it's going to take, what till what duration you are having it, what is the cause, it depends on both the things. Okay. Uh, Recovery depends, that's what I told you, what is the cause and what is the duration. In it, IT industry, and my age is 23. Sometimes I have so much work. Will it lead to something bad, and what are the things I can do to handle that? See, amount of the work, it varies from person to person. Some people work a lot. Some people, it varies. For if you are able to handle the stress, well and fine. But working a lot, the number of duration of working hours, I don't think so is bad to any health. If your sleep is fine, if your mood is sound, number of working hours doesn't have much impact on it. But definitely it needs to be, there has to be certain boundaries for that. You can take rest on next day. That way I can tell you, I can understand MNCs and even the doctors, we are working 24, 24 round the clock. So that is very subjective question. Ki, how many working hours is suits person? It depends. It depends. If it is not taking a toll on your mental health, if it is not taking toll on your personal health, I don't think so. It needs to be, it's any serious.
No more queries, ma'am. We can wind up.
Okay, should I anything else? If any queries regarding my lectures you are unable to, you're unable to understand or so, I can, we still have time, I guess. You can still let me know. I can, repeat it for that because this is very important. I think हमें guidelines और थोड़ा सा awareness के लिए है hypertension की. If you ठीक है. Okay.